morning, everyone. Today is Thursday, November 8th. Thank you so much for joining into our weekly healthcare reform webinars. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. We do have a couple new folks on the call today, so I wanted to let you know how to ask questions if you're so inclined, and questions are definitely encouraged. These webinars, as I've mentioned often, started more than 5 years ago. And we've been running them weekly except for, a few weeks. It's really started as a place where you can go to get your questions answered, learn what's going on both at our Commonwealth level and a national level, legislatively, products, everything that you want to know, hopefully, you'd be able to know. So again, questions are encouraged because we all learn from each other. So just with a show of hands, if you can raise your electronic hand icon. Okay, great. You can all hear me and see my screen. That is also the way you can raise your hand if you want to answer or ask your question live, or if you want to type it in to the question box. I'll answer that at the end of the webinar. I also have several attachments in the handout segment. One is the 2019 agent compensation grid for the Pennsylvania individual and short-term medical carriers. Also our Colonial Life and URL bonus. That is a production bonus that's running through the end of December, so be mindful of that. If you're writing group health with us, you can look for ancillary lines and qualify for the bonus. And also, we put in the November and December submission deadlines, so that is also in your handouts. So let's just jump right in. As we know, last week at this time was the first day of open enrollment on the individual and family site. The resources that we have available at URL is our quoting portal on our site. You cannot apply for or through it, of course, but you can go to under health plan options on our site and go to quoting tools, and you'll see the marketplace quoting tool. It only quotes marketplace plans, but it would give you an idea of expected subsidies, pricing, what's available, etc. So that's a resource. Also on our website, except for Geisinger, we do have all of the carriers' information on our website for the individual plans. The only one, again, is Geisinger. Independence we got in yesterday, and that is currently being loaded on our site, so that should be there as well. Interesting stat, they said that first week last year of marketplace enrollments equaled about a little over 600,000, it was working on about 151,000 per day being enrolled. This year it's down, I think, pretty significantly, down to about 372,000 enrollees, about 124,000 per day. So that's a pretty big reduction. This is national, so they talk about possibly folks going to association health plans or the short-term limited duration plans, but I thought it was kind of interesting that folks are looking outside the marketplace. Pricing is a factor for sure. Election results in Pennsylvania. What does it mean for our Commonwealth? Well, the short-term limited duration insurance is probably not going to expand to the 364 days. We are currently at 89 days, according to the insurance department. Association health plans formation, that's probably not going to be revived either. Our insurance commissioner helped draft the legislation and write the Affordable Care Act bill, so I'm sure she's very fond of it, and Pennsylvania as a whole with our Democratic governor and Democratic insurance commissioner is going to default to the ACA programs. Obviously, that's what's important to them. So doesn't look like there's going to be a whole lot of innovation in Pennsylvania. Pennsylvania did flip several Republican-held seats to Democratic seats. We still hold the majority for both our state Senate and House, but Pennsylvania Senate did lose their veto-proof majority, so that could be a factor, of course. Nationally, You know, with the House now being controlled by the Democrats, there's just no chance of repeal in place for about 2 years. So that is probably announcing that there may be more gridlock. I hope not, but I don't think anything legislatively will come through to weaken the Affordable Care Act law. They probably will move towards strengthening it, excuse me. Also yesterday, President Trump released new regulations that relax the employer requirements to provide birth control at no cost. As you recall, part of the Affordable Care Act and some of the early lawsuits with Hobby Lobby and Notre Dame University were opposed to providing birth control to their employees. It's a religious exemption. So the new regulations apply mainly to those same religious organizations and nonprofits and small businesses that have those religious and or moral objections to covering the birth control. But now it also will extend to institutions of education, issuers, and individuals. So the rule is set to take effect after a 60-day comment period. So I'm sure we'll learn more as we move through those 60 days. Additionally, yesterday, tighter rules were proposed on ACA plans that cover abortion. The administration said that the changes are intended to ensure that taxpayer provided subsidies for on-marketplace plans are not used to pay for abortion. So that's some new stuff going on. We continue now with our agenda and the short-term limited duration drama that we have going on. Of course, if you've joined in the last couple of weeks, you know that one of the carriers filed for 364 days under the Life Association in the state of Texas. Pennsylvania is saying they have to file in Pennsylvania as well. The carrier is saying, no, we do not. So we did pull that information from our website. We have to defer to the Pennsylvania Insurance Department, obviously. We don't want to be promoting or selling anything that could open you or us up to liability. So if you are interested in selling the short-term medical insurance, Pennsylvania is still 89 days. We do have IHC on our site. Unfortunately, we had to pull the National General. We are really excited and hoping and crossing our fingers to get it back. We'll see what is going to happen. I believe the two entities, the Insurance Department and National General, are talking it over. There could be a loophole. It could end up being perfectly fine, but at this point, with the concerns from the Pennsylvania Insurance Department, we are not promoting it. Benefix, our group quoting system, has loaded all 2019 group rates. So if you are looking for 1/1/2019 rates for your groups or beyond, get those into us. The NEPA BOR news, for those of you that joined us last week, Carrie McEwen talked about the NEPA BORs, that they would be honored in 2019 for previously non-brokered groups and commissionable. The BORs will follow the rules of if they're received from the 1st to the 10th, then the BOR would become effective the 1st of the next month. And if it's received after the 11th or the 11th or after, then it would be the 1st of the following month. So for instance, if you sent in a BOR now, it's the 8th of November, that's before the 10th, so it would be effective 12/1. If it was received the 15th of November, or the 11th or after, it would become effective 1/1/19. But it's a very great opportunity to reach out to those NEPA groups if you're in Northeastern segment, and if they're not brokered, pick them up as a client and increase your revenue, and they get the service of your organization. So that's a good thing for them as well. Group health submission deadlines, again, I mentioned those flyers were attached. Elise and her team put those together. If you have questions on the submissions, just reach out to your case manager, but also be mindful of them. They are hard and fast, and we've got to adhere to them, and the furthest thing we want to happen is to have a group not get the requested effective date because of incomplete or late paperwork. So work with us on this, and we'll work with you and try to get those groups in ASAP. Mentioned about the individual information on our site. Continuing the Cap Blue Cross Commission retractions, they're going to be hitting, so you're going to be seeing those. They are for the under 65 and over 65 med sups with capital. Please review not only your October statement with those retractions, but your November statements as well, because word on the street and word from Capital is that the retractions were not accurate, and they are working to correct them, but you know how it's going to end up. It's going to be a real mess, so just please review those statements. Reach out to Brandy and her team in the event that you see a glaring error. And that, at this point, brings us up to our open discussion, and just know that next Thursday, the 15th, I'll be back here holding our webinar, but the following Thursday, which is Thanksgiving, we will not have a webinar. You wouldn't be interested in listening to me then anyway, so it's a good thing. So let's see what questions we have. If anyone has a question and wants to raise their hand, they can go ahead and do that, and I'll unmute you. Okay. I have no questions except a comment from Joe, and Joe, that is fine. I will reach out. All right, well, that seems to be it for today. As always, I so appreciate you joining in. If you need anything, have any questions, my contact information is here. If you want to learn more about our Gemini Partners program, let me know. Our Orion program, let me know. We're happy to explain that and hopefully gain new opportunities for you. So as always, I thank you so much for joining in. I wish you all a great balance of the week and a wonderful weekend. Bye-bye.